Witch hazel, fiber supplements, Sitz Baths, aloe vera. The internet is full of remedies, but which ones work? Which are a total waste of time? For the next 60 minutes, we rank every popular home remedy on the official Silver Smile and Bites tier list. From F tier, the absolute failures you should stop using today, to A tier, the lifesavers that offer lasting relief. You will likely be shocked by what you discover, especially what lands at the top of the list. We start at the bottom with the things you must abandon immediately. Welcome to the F tier. Before we dive into what fails, understand why this ranking is crucial for your vitality. Hemorrhoids are extremely common, especially in adults over 55, but they steal everyday comfort and confidence. This isn't about masking pain. It's about establishing a gentle, consistent routine that promotes natural healing from the inside out. We filtered the weak suggestions and focus solely on methods proven to reduce pressure and accelerate recovery. If you appreciate this clear, evidence-based approach to health, please subscribe right now. Hitting that notification bell ensures you receive all our simple guides designed for lasting comfort and vitality. The F tier is our failure tier. These are habits or remedies that actively damage the tissue and sabotage your healing efforts. Stop doing these immediately. Our first item in the F tier is aggressive wiping and dry, rough toilet paper. This is the fastest way to turn a minor irritation into a serious, painful, bleeding issue. The tissue surrounding hemorrhoids is tender, often inflamed, and extremely fragile. Scrubbing with dry paper is actively irritating the skin. It causes micro tears, prolongs inflammation, and leads to greater pain and swelling. If you are still relying on dry, coarse paper, you are undermining your own efforts at relief. This habit earns a definitive F. The ultimate fix is simple, but we save that A-tier solution for the final segment. For now, understand that aggressive friction belongs firmly in the F tier. Our second F-tier item is ignoring the urge to go. When your body signals it is time for a bowel movement, you must respond promptly. Delaying a trip to the bathroom, whether due to inconvenience or while finishing a task, allows your colon to absorb excess water from the stool. This results in waste becoming harder and drier, which guarantees you will strain significantly when you finally try to pass it. Straining is the single greatest factor that causes existing hemorrhoids to swell or new ones to form. It dramatically increases pressure on the pelvic and rectal veins. Delaying bathroom visits creates a vicious, painful cycle. This is a critical habit change. Do not put off a bathroom visit for an hour, especially not first thing in the morning. Our third failure in the F tier involves excessive use of scented or alcohol-based wipes. While a moist wipe seems superior to dry paper, the additives in many commercial products can be highly corrosive to sensitive skin. Artificial fragrances, harsh preservatives, and alcohol can cause contact dermatitis, which is a skin reaction that mimics or dramatically worsens hemorrhoid symptoms. Your delicate tissue is already compromised, so adding drying irritants is highly counterproductive. If you reach for a wipe, read the label carefully. If it has a strong scent or includes harsh drying alcohols, it is an F tier irritant. Look for plain, unscented, and hypoallergenic wipes. But truly, we will show you an A tier solution soon that makes relying on wipes unnecessary. Our final F tier entry is aggressive topical remedies like undiluted apple cider vinegar. While ACV is widely promoted online, applying it directly to sensitive, inflamed tissue often causes severe pain and can even lead to chemical burns or widespread irritation. There is virtually no reliable evidence suggesting this aggressive approach works for healing hemorrhoids. The acidity is far too intense for this delicate area. When dealing with swollen veins and thin skin, our goal is to soothe and shrink, not burn or shock. If you encounter any advice suggesting painful, aggressive topical applications of highly acidic substances, immediately mark it as F tier. Effective relief must be gentle and non-agonizing. To summarize the F tier, stop scrubbing, stop delaying the urge, stop using scented irritants, and stop applying painful chemicals. Fixing these 4 habits provides the essential foundation for starting your healing journey. Now let's move up the list to the C tier. These aren't actively harmful, but they are often distractions that only offer temporary, highly limited help. They rarely solve the core issue. Welcome to the C tier. These remedies are only situationally helpful. They often mask uncomfortable symptoms or provide minor cushioning without addressing the underlying mechanics of pressure and straining. Our first C-tier item is the asterisk donut pillow. Many people purchase these round, air-filled cushions, believing they relieve pressure while sitting. Unfortunately, a donut pillow often increases pressure in the wrong places. By forcing the weight onto the rim of the cushion, they can actually concentrate pressure exactly where the hemorrhoids are located, in the perianal region, and allow the tissue to prolapse or swell further into the open hole. They may feel momentarily comfortable, but they can restrict necessary circulation and worsen the problem over extended use. If you require padding, a flat, dense cushion, or simply ensuring you stand and move frequently is a much safer approach. The donut pillow lands in the C tier because while its intent is right, reducing painful sitting, its mechanical design is flawed. Next up in C tier, we have asterisk over-reliance on strong laxatives or harsh stimulants. While constipation is the primary trigger for straining, relying on aggressive chemical laxatives to force a bowel movement is not a healthy or sustainable long-term strategy. These products frequently cause severe cramping, sudden urgency, or diarrhea, which can further irritate existing hemorrhoids. Diarrhea, due to its frequency and sometimes acidic nature, can be just as damaging to the inflamed area as hard constipation. We must achieve a just right stool consistency, soft, formed, and easily passed without effort. Strong chemical stimulants disrupt the natural rhythmic function of the colon and can lead to dependency. We will explore A-tier solutions that solve constipation naturally and gently, but quick-fix harsh laxatives remain a temporary C-tier solution. Our third entry into the C-tier is asterisk using over-the-counter hydrocortisone creams as a primary solution. These creams contain corticosteroids that are highly effective at reducing inflammation, which provides fast relief from swelling and itching. So why are they only C-tier? Because they function as a powerful mask. They soothe the symptoms, but entirely fail to address the core problem, the chronic straining and pressure. They are immensely useful for acute, painful flare-ups, but should not be used long-term. Prolonged daily steroid use can thin the skin in the area, making it more vulnerable to micro tears, bruising, and infection. View these creams as a temporary shield, not a long-term solution. Use them strictly and sparingly for 3 to 7 days during a severe episode, but if you find yourself needing them every week, you are neglecting the true preventative problem. Your consistent focus must be on integrating the A-tier habits that render these strong temporary aids unnecessary. Finally, in the C-tier, we place asterisk commercial, highly processed fiber drinks or bars. While technically providing fiber, they often land here due to unintended downsides. Many widely marketed bars and powders contain substantial hidden sugars, artificial sweeteners, or high levels of processed ingredients that can trigger excess gas, uncomfortable bloating, and generalized intestinal distress. For those 55 and older, digestive sensitivity often increases, making these heavily processed sources counterproductive and sometimes painful. While fiber is absolutely crucial, obtaining it from whole, natural food sources is vastly superior to relying on supplements that might cause unwanted digestive turbulence. They offer limited help, therefore earning their C-tier spot. We successfully cleared the bottom half of our list. You now understand what to actively avoid and what to reserve only for acute symptom management. Now we transition into the highly reliable, evidence-based methods that genuinely support healing and management. Welcome to the B-tier, solid and reliable. These methods are excellent for symptom relief, comfort, and immediate management during a painful flare-up. Our first B-tier champion is asterisk witch hazel pads or solutions. Witch hazel is a natural, gentle astringent. Astringents cause body tissues to contract and slightly shrink. This mechanism is highly effective for swollen, inflamed hemorrhoidal tissue. The active ingredients, called tannins, help constrict the tiny blood vessels and reduce localized bleeding, providing quick and noticeable relief from discomfort and swelling. However, application technique is important. Apply it gently using a clean cotton pad. Place the pure liquid witch hazel solution on the pad and simply dab or place the pad against the affected area for a few minutes. Crucially, ensure the solution you use is pure and free of any added alcohol, which can negate the soothing effect by causing irritation. Witch hazel is ranked B tier because while it expertly manages symptoms, it does not fix the root cause, the chronic pressure, which is the domain of the A-tier solutions. For immediate soothing comfort, few things work better than refrigerated witch hazel. Our second reliable B-tier remedy is asterisk cold compresses, or ice packs. Applying cold constricts the local blood vessels, rapidly reducing swelling and providing effective pain numbing. This is an excellent drug-free way to manage acute pain, particularly during the first 24 to 48 hours of a new flare-up. To use this safely, never apply ice directly to the skin. Always wrap a small ice pack or a bag of crushed ice in a thin towel or soft cloth. Apply it for short periods, specifically 10 to 15 minutes at a time. This cyclical application helps the blood vessels contract, then relax, helping to move pooled blood out of the inflamed tissue. Why does this remain B tier and not A tier? Because it is purely a symptom manager. It stops the immediate pain, but it doesn't change the daily habits that caused the problem to begin with. Yet, for reliable, immediate relief when pain spikes, the cold compress is an invaluable tool. Next up, we place asterisk pure aloe vera gel asterisk firmly in the B tier. Aloe vera is known for its strong anti-inflammatory properties and its capacity for healing. It is incredibly soothing. Unlike many general commercial body lotions, pure aloe vera, whether directly from the plant or a high-quality 99% pure commercial gel, is mild, non-irritating, and effectively relieves burning and persistent itching. Confirm the product you use contains no added colorings, fragrances, or alcohol. The label should clearly state 99% or 100% pure aloe vera. Simply apply a small, cool dollop of the gel very gently to the tender area. It provides a thin, protective barrier and helps reduce overall skin sensitivity. Aloe vera is a simple, highly reliable, natural remedy that aligns perfectly with our goal of gentle, holistic vitality. Its effectiveness for reliable symptom relief secures its B-tier position. Our final item in the B tier is gentle movement, focusing on regular walking. This might appear unconventional, but its benefit is profound. Sedentary behavior, sitting for prolonged periods, significantly increases pressure on the delicate veins in the pelvis and rectum, which is the exact mechanism that promotes hemorrhoid formation. Gentle movement, particularly walking, helps maintain regularity in the bowels and, critically, vastly improves circulation throughout the entire lower body. Improved circulation reduces the pooling of blood in those inflamed veins. You don't need exhausting exercise. A comfortable, gentle walk of 20 to 30 minutes each day is plenty, even more effective. Intentionally break up prolonged sitting by getting up and moving for just 2 minutes every single hour. This simple habit of interrupting static sitting is a powerful preventative strategy. Walking remains B tier because it supports a healthy healing environment, but doesn't correct the fundamental mechanical issues of diet or positioning, which are reserved for the A tier. We have successfully navigated the remedies that must be avoided and those that are reliable for immediate comfort. Now we prepare for the reveal of the A tier. These are the foundational, non-negotiable elements that actually treat the root causes, leading directly to sustained relief and prevention. If you adopt these habits consistently, you fundamentally change your ability to heal. Welcome to the A tier. These 4 items constitute the absolute building blocks of enduring comfort and vitality. If you integrate these steps consistently, you can drastically reduce the frequency, duration, and severity of future flare-ups. This is the payoff we promised at the start. The definitive, long-term plan for taking sustained control of your health. The first A-tier solution is perfected hydration. While seemingly simple, this is the absolute non-negotiable bedrock of a healthy, functioning digestive system. Hemorrhoids are most commonly triggered by hard, difficult-to-pass stools. Water is the primary tool your body uses to soften waste material. If you maintain even mild dehydration, your colon will aggressively pull residual moisture from your stool, making it dense, dry, and inevitably requiring strenuous effort to pass. Drinking adequate, steady amounts of water throughout the day ensures that the fiber you consume can fully activate, creating the bulky, soft, and easy-to-pass stools we desire. Your simple goal should be urine that is consistently clear or only very pale yellow. Do not wait until you feel thirsty. Consciously keep a glass or bottle nearby and sip frequently, making hydration a constant priority. For adults over 55, the natural sensation of thirst sometimes diminishes, making conscious, scheduled hydration even more critical. Make clean water your most vital, daily preventative medication. It belongs in the A tier because without sufficient water, every other remedy on this entire list is significantly less effective. Our second non-negotiable A tier remedy is soluble fiber, sourced directly from whole foods. While we rightly demoted processed fiber supplements to the C tier, the right kind of dietary fiber is truly a long-term lifesaver. Soluble fiber dissolves completely in water, hence the critical need for hydration, and forms a soft, gel-like substance within the digestive tract. This action naturally softens the stool, increases its bulk without causing irritation, and allows it to slide through the colon easily and quickly. Excellent, gentle whole food sources include rolled oats, barley, fresh apples, soft pears, carrots, and various kinds of beans. Start slow and deliberate. If you suddenly introduce an overwhelming amount of fiber, you will likely experience uncomfortable gas and severe bloating. Gradually increase your intake over 2 to 3 weeks, ensuring you dramatically increase your water consumption alongside it. Aim for daily consistency, not sporadic high doses. A small bowl of oatmeal every morning, a piece of soft fruit with lunch, and steamed vegetables with dinner provides a simple, effective pathway to regularity. Fiber is A tier because it directly solves the problem of straining and hard stools, addressing the root cause of almost all hemorrhoid flare-ups. Our third essential A-tier item is the asterisk dedicated Sitz Bath ritual. This simple, ancient practice is unmatched for promoting local healing and powerful soothing. A Sitz Bath involves soaking the affected area in warm, shallow water for 10 to 20 minutes, ideally 2 to 3 times per day during a flare-up. The gentle warmth of the water rapidly promotes blood flow to the immediate area, which is vital for carrying away inflammation and encouraging the body's natural restorative processes. Crucially, the warmth also helps relax the anal sphincter muscle, immediately reducing painful tension and spasms. Furthermore, the Sitz Bath gently cleanses the area without any harsh rubbing or wiping, which prevents additional irritation. You can use your regular bathtub or a dedicated basin that fits over the toilet bowl. The water should be comfortably warm, never scalding hot. The Sitz Bath secures its A-tier ranking because it simultaneously cleanses, deeply soothes, and accelerates actual tissue healing by improving local circulation. Make this a peaceful, necessary ritual of daily self-care. Our fourth and final A-tier champion is asterisk optimized positioning and the simple footstool. Most modern toilets force us into a sitting position that restricts the natural angle of the rectum, forcing us to bear down and strain unnecessarily. The simple, mechanical solution is to subtly mimic a squatting position. This naturally straightens the colon and allows gravity and the internal mechanics of your body to pass waste easily. This optimized position is achieved by using a small footstool to elevate your knees slightly above your hips while seated on the toilet. This change in angle, even if only 3 to 7 inches of elevation, is a monumental improvement. It reduces the physical need to push or strain dramatically. We designate this as A-tier because it corrects the fundamental mechanical flaw introduced by modern plumbing. It is a one-time adjustment that yields profound benefits daily in terms of reduced pressure, reduced strain, and minimized discomfort. If you could only implement one item from this entire 60-minute guide, making a footstool a permanent fixture in your bathroom might be the single most powerful change you make today. Now that we have covered the full spectrum, from the F-tier dangers to the A-tier essentials, we must spend a few critical minutes addressing common roadblocks and specific adaptations for our 55-plus audience. Many older adults routinely take maintenance medications that can unfortunately contribute to constipation, such as certain common pain relievers, iron supplements, or blood pressure medications. If you find the A-tier approach, consistent fiber and perfected hydration, is not yielding soft stools, you must discuss this with your doctor. Never adjust or stop a prescribed medication without explicit medical guidance, but understand that medication side effects may necessitate a carefully monitored increase in hydration or the use of specific, gentle bulk-forming agents recommended by a physician. If mobility presents a concern, adapting the movement pillar is absolutely crucial. If long, sustained walks are challenging, shift your focus intensely to the recommended 2-minute movement breaks every hour. Gentle chair-based exercises, seated leg raises, and simple seated stretches are still remarkably effective at boosting circulation and relieving damaging pelvic pressure. Always remember, the ultimate goal is not high-intensity cardio. The goal is simply to interrupt long, static periods of sitting. Even slight movement helps tremendously. Finally, we address the distinction between prevention and acute care. Always utilize the B-tier remedies, witch hazel, cold packs, aloe vera, during painful flare-ups for immediate symptom management. But the A-tier habits, perfected hydration, soluble fiber, the footstool, the Sitz Bath, must be integrated into your life every single day, without fail, regardless of whether you are currently symptomatic. Prevention is the unwavering key to maintaining lasting comfort and vitality. Consistency in these core habits is your greatest and most reliable ally. If you have stayed with us through this comprehensive 60-minute guide, you are now equipped with a clear, ranked action plan. You know precisely which habits to permanently discard and which powerful, evidence-based tools to adopt immediately. Your comfort and confidence are fully within your control. Take this clear plan and commit to implementing just one A-tier item today. Make it the footstool, or make it adding 4 extra glasses of water to your daily total right now. Start small, but start immediately. If this detailed ranking has helped you clearly understand how to regain long-term comfort, please show your appreciation by liking this video. Liking the video signals to the algorithm that this trustworthy, practical information is valuable, which ensures that other adults seeking relief can easily find the support they need. We are dedicated to providing crystal clear, step-by-step guidance for improving your everyday vitality. Your relief begins now.